parasympathetic nervous system, or PSNS. So this activates the rest and digest response. So the stimulation of the parasympathetic nervous system causes the stimulation effects of the following. Cardiovascular-wise, it decreases the heart rate, although at times it can increase the blood pressure. Most often you will see a decrease in blood pressure. In addition, pulmonary, it can cause bronchoconstriction. GI, it increases peristalsis or motility and increases saliva production. In the liver, it can increase or decrease glycogen as well as fat breakdown. However, most commonly, it does increase glycogen stores, so it stores the glucose in the form of glycogen. Renal-wise, it can increase urinary output. Lastly, in the eyes, you will notice pupillary constriction or pupil constriction. The drugs that stimulate the parasympathetic nervous system are your cholinergic agonist agents. Cholinergic agents response are basically response caused by the action of acetylcholine. The side effects of cholinergic agents include sludge, SLUDGE, or salivation, lacrimation, urinary incontinence, diarrhea, GI cramping, and emesis. The way I easily remember this is by remembering that anticholinergic, or the opposite, has drying effects or drying side effects, while cholinergic, or the opposite, will have very moist or wet side effects. Nursing considerations. So we need to make sure, one, that we're assessing for therapeutic and side effects. In addition, when it comes to patient education, we need to teach our patients on how to monitor their own heart rate and blood pressure. Also, it is important to educate them about the appropriate dosing, some safety issues pertaining swallowing, and possible vision changes due to the increased salivation and lacrimation. Examples of drugs under this class include Aricept or donepezil. So again, donepezil is to increase concentration of acetylcholine in the brain, and so this medication's indication is to treat mild to moderate Alzheimer's disease. Next medication is mestinone or pyridostigmine. So the action of this medication is decreasing acetylcholine esterase, therefore increasing the levels of acetylcholine. So the indication for this drug include treatment for myasthenia gravis, and it also reverses non-depolarizing neuromuscular blocking agents. As mentioned earlier, mestinone or pyridostigmine is used for myasthenia gravis. Myasthenia gravis is an autoimmune neuromuscular disease which causes weakness in the skeletal muscles, which are responsible for breathing and moving parts of the body. So this medication is used for that. And in addition, is a reversal agent for neuromuscular blocking agents such as vicuronium and rocuronium. Cholinergic antagonist agents or anticholinergic. So these drugs block acetylcholine. So again, this is the opposite of cholinergic agents. So side effects of this drug include the following. So we have to remember this: mad as a hatter, blind as a bat, red as a beet, and dry as a bone. So mad as a hatter, basically it causes CNS effects, so it can lead to sedation. So changes in the mental status, it can cause amnesia or hallucinations or confusion. Blind as a bat, basically, it's because it dilates the pupils, causing blurred vision. Red as a beet causes vasodilation, therefore causing that flushing appearance or redness in the skin, and it can also be accompanied by hyperthermia or increased body temperature. Dry as a bone is basically a consequence of decreased sweating, salivation, and lacrimation. So it decreases the oral secretion. And a way to address this side effect, sometimes we can make the patients chew sugarless gum or suck on a hard candy to counter this side effect. Nursing considerations. Again, we need to assess for therapeutic and side effects, monitor heart rate and blood pressure as appropriate, and remember that atropine can be an additive in other agents, but also atropine is a medication that we use for decreased heart rate. So it's a treatment for bradycardia, and so it will cause increased heart rate. And lastly, patient education. We need to ensure that we're educating our patients pertaining the drugs and why are we giving these medications and so on. Examples of drugs under this class include atropine. So atropine is a receptor bound which causes a decrease in nerve transmission of acetylcholine. So this is indicated for symptomatic bradycardia, pupil dilation, and decreased secretion, but mainly you will see this being used for symptomatic bradycardia. Bentyl or diclomine, the action is decrease in GI motility. So this is an antispasmodic medication. So the indication is GI motility disturbances such as irritable bowel syndrome. Cogentin or benztropine, this is a synthetic anticholinergic and antihistamine agent. The indication is Parkinson's disease. So this is an adjunct treatment to Parkinson's disease. This reduces the rigidity and tremor of patients. Detrol or tolterodine, the action is muscarinic receptor blocker. Specifically, it helps with the urinary bladder. So it is an antispasmodic of the urinary tract system. Indications include urinary frequency, urgency, and urge incontinence syndrome. Lastly, transderm scope or scopolamine, it is an antimuscarinic agent. It corrects imbalance between epinephrine and norepinephrine. So the main indication of this drug is to prevent motion sickness. So under the sympathetic nervous system, we have the adrenergic agonist, which has anticholinergic effects, and you also have adrenergic antagonist that has cholinergic effects. Under adrenergic agonists, we have levoalbuterol, epinephrine, albuterol, pseudoephedrine, and salmeterol. So these medications mainly are adrenergics. They stimulate the fight or flight, and they have anticholinergic effects. Adrenergic antagonists are the opposite. So again, these have cholinergic effects, and so they block the norepinephrine and epinephrine. So this is for rest and digest. Medications under this include your metoprolol, atenolol, phentolamine, prazosin, and doxazosin. The parasympathetic nervous system, you will have your cholinergic agonist as well as your cholinergic antagonist. So your cholinergic agonists have anti-adrenergic effects. So these are for rest and digest effect. Medications under this class include donepezil and pyridostigmine or mestinone. Under cholinergic antagonists, so these have adrenergic effects, we have scopolamine, tolterodine, atropine, benztropine, and diclomine.